let's go back to what Governor Romney indicated, that under his plan, he would be able to cover people with pre-existing conditions. Well, actually, Governor, that isn't what your plan does. What your plan does is to duplicate what's already the law, which says, if you are out of health insurance for 3 months, then you can end up getting continuous coverage, and an insurance company can't deny you if it's been under 90 days. But that's already the law, and that doesn't help the millions of people out there with pre-existing conditions. There's a reason why Governor Romney set up the plan that he did in Massachusetts. It wasn't a government takeover of health care. It was the largest expansion of private insurance. But what it does say is that insurers, you've got to take everybody. Now, that also means that you've got more customers. But when Governor Romney says that he'll replace it with something, but can't detail how it will be in fact replaced, and the reason he set up the system he did in Massachusetts was because there isn't a better way of dealing with the pre-existing conditions problem. It just reminds me of, he says that he's going to close deductions and loopholes for his tax plan. That's how it's going to be paid for, but we don't know the details. He says that he's going to replace Dodd-Frank, Wall Street reform, but we don't know exactly which ones. He won't tell us. He now says he's going to replace Obamacare and assure that all the good things that are in it are going to be in there, and you don't have to worry. And at some point, I think the American people have to ask themselves, is the reason that Governor Romney is keeping all these plans to replace secret because they're too good? Is it because that somehow middle-class families are going to benefit too much from them? No, the reason is because when we reform Wall Street, when we tackle the problem of pre-existing conditions, then these are tough problems, and we've got to make choices. And the choices we've made have been ones that ultimately are benefiting middle-class families all across the country.
We're going to move to a...
No, I have to respond to that, well, which is my experience as a governor is if I come in and lay down a piece of legislation and say it's my way or the highway, I don't get a lot done. What I do is the same way that Tip O'Neill and Ronald Reagan worked together some years ago. When Ronald Reagan ran for office, he laid out the principles that he was going to foster. He said he was going to lower tax rates. He said he was going to broaden the base. You've said the same thing. You're going to simplify the tax code, broaden the base. Those are my principles. I want to bring down the tax burden on middle-income families. And I'm going to work together with Congress to say, okay, what are the various ways we could bring down deductions, for instance? One way, for instance, would be to have a single number. Make up a number, $25,000, $50,000. Anybody can have deductions up to that amount. And then that number disappears for high-income people. That's one way one could do it. One could follow Bowles-Simpson as a model and take deduction by deduction and make differences that way. There are alternatives to accomplish the objective I have, which is to bring down rates, broaden the base, simplify the code, and create incentives for growth. And with regards to health care, you had remarkable details with regards to my pre-existing condition plan. You obviously have studied up on my plan. In fact, I do have a plan that deals with people with pre-existing conditions. That's part of my health care plan. And what we did in Massachusetts is a model for the nation, state by state. And I said that at that time. The federal government taking over health care for the entire nation and whisking aside the 10th Amendment, which gives states the rights for these kinds of things, is not the course for America to have a stronger, more vibrant economy.